So, part 2 of myths related to mental illness. So, last time we discussed 6. So, today, the 7th one. I don't need medications for my mental illness. I can manage it on my own. Yes, medications are not required for milder cases of anxiety and depression, which can be managed with lifestyle changes, adopting healthy coping strategies, and therapy. Just like, individuals who have borderline diabetes might be able to control their sugar levels with lifestyle and diet changes. But when an illness is severe and debilitating, therapy, even therapy might not work in very severe cases where you don't have the mindset to work on yourself. Even resorting to mindset mentors, coaches, and those kind of things may not really work. But remember that even a psychiatrist will not really prescribe you medications unless they deem that it is absolutely necessary. So when somebody is recommending that medications are required, it is because there is no other way that can be thought of at that moment. 8th, once you get a mental illness, there is no cure. Yes, sometimes it can happen that an illness will have a long protracted course requiring you to continue medications for a longer period of time. But with therapy, medications, lifestyle changes, or a mixture of all three, one can live a very happy and fulfilling life despite having a mental health condition. So, while there might not be a permanent solution at times, help is always available. 9th, all psychiatry related medications are habit forming or addicting. While some medications like sleep or anxiety related medications might be addicting when they are taken on a long run, but a psychiatrist will always warn you while prescribing medications like that, and these will always be given for a very short course when required. The rest medications like antidepressants, anti-anxiety medications, mood stabilizers aren't addicting. 10th, once you start with medications, you have to take it lifelong. It really depends on the nature of the illness. In many cases, when a major life stress precipitates an episode of depression or anxiety, and the patient recovers from it well, and does not have any kind of risk factors, the doctor will slowly reduce the medications and stop them completely. However, just like diabetes or hypertension or arthritis can become chronic and require long-term medications, even psychiatric illnesses can be chronic and happen in the form of repeated episodes. In these cases, the doctor will suggest continuing medications on a steady low dose to prevent recurrence of the illness. 11th, psychiatric medications make you zonked or drowsy throughout the day and make you gain weight. Not really. In few cases, when the illness is severe and in the initial phase of treatment, there is a risk of agitation and violence from the patient towards people around them. These kind of medications might be specifically prescribed to tranquilize or calm the patient down. However, in all other cases, your doctor will always prescribe you medications on an individual basis, depending on your needs, your work timings. Someone who is finding a hard time to sleep at night might be given a medication that helps with sleep. Somebody who feels tired and sleepy the entire day might be given medications that will make them feel more active instead. But despite everything, there is always a chance, a very slim chance of it happening, since all of us react to medications in different ways. In such a case, there can always be a change of the medication to something else after consulting with your doctor. Thank you.